guys, my name is Maddie. I'm presenting on bipolar disorder. So as you guys know, it's a pretty common disorder. I learned a lot about the disorder through this research paper, however though. So some of the common symptoms are unusual shifts in mood, loss of energy, the inability to complete daily tasks. What I didn't know is that there's 4 different types of bipolar. So there's bipolar 1, 2, the third type is called cyclothymic, and then the other one is other specified or related diagnoses. So that's from the DSM-5. So between the 4, they're all rather similar. The symptoms vary in severity, with bipolar 1 being the most severe, and then others specified being the least severe. So according to the DSM-5, bipolar 1 is manic episodes that last 7 days, so severe that they need to be hospitalized immediately, and usually depressive episodes occur as well that last 2 weeks. Bipolar 2 is defined by a pattern of depressive episodes and hypomanic episodes, but it's not the full-blown manic. So the manic disorder, signs of it could be you're feeling elated, lots of energy, increased activity, you're feeling jumpy, troubled sleeping, unusual activity. So basically your typical manic disorder. So with bipolar 2, they're not full-blown. You see the symptoms, but they don't have to be hospitalized. With the cyclomaniac, the DSM-5 defines it as numerous periods of hypomanic symptoms and numerous periods of depressive symptoms lasting for 2 years. So they're not near as severe, they just have similar symptoms, but there's no hospitalization and there's never a manic disorder. And then obviously the other specified is just any of the symptoms above, but there's no diagnosis. So with the manic disorder and the depressive disorder, the manic you're feeling really high, depressive you're feeling really low. There's a huge switch that occurs between the two, that's why it's called bipolar. And so with the physiological aspect of it, of course, the one I pick, there is no known reason why it occurs the way it does. So I looked through a lot of research articles and research experiments that people had done in the past. So there's, again, nothing. A couple of the research experiments talked about serotonin and tryptophan. So most of us know serotonin makes you happy, makes you feel up. It's a neurotransmitter. Tryptophan, however, I thought was interesting because I learned about it in genetics in the past, but I didn't know that it really affected our serotonin levels. So one of the research articles talked about that if tryptophan is low, then that will initiate serotonin reuptake. So they did this experiment where they took people that were unrelated to patients with bipolar, and they took other patients that were related to non-bipolar. So they had 20 each, pretty clear study. And in the end, they found that the people that were related to the patient with bipolar ended up having low availability of tryptophan. And another thing about bipolar is that it's hereditary, so that also proved that it was hereditary and that these people are more likely or more at risk to develop bipolar in the end. So I thought that was interesting. There was a couple research articles that said that it's has to do with the monoamine pathway. It's another neurotransmitter. There was a lot of different neurotransmitter pathways because obviously it was a psych disorder. They're all neurotransmitter, but it's just as hard to diagnose as it is to understand why it's the way it is. So serotonin and tryptophan are pretty much the main guesses they have right now. With the manic and depressive orders, there's always a switch that has to occur for the other one to initiate. So the switch obviously remains unknown, but there's guesses. So some external factors that can initiate the switch is sleep deprivation, exogenous corticosteroids and dopaminergic agnostics. So main thing I got from that was like sleep deprivation, and on down it talks about medications. So like the multiple medications that the patients are on can affect all the chemicals in our brain, neurotransmitters. Obviously that's its job, but like if you're on an antidepressant and you're going through a manic disorder, the manic disorder won't end because you're on the antidepressant, so you can never go back down to your low. And then treatment, there's obviously medications. A lot of people are on mood stabilizers like lithium, antidepressants, anti-anxiety. Anxiety and depression obviously are very similar and are associated with bipolar disorder. You can get on SSRIs, which are serotonin reuptake inhibitors. It'll help you, again, with the antidepressant and make you feel more up than you do down. So basically finding the right medication to stabilize. There's a lot of support groups I found online. Basically just staying away from like triggering factors like drugs and alcohol, and then staying on medication. So there's not much known facts about bipolar that goes on in the brain, but there seems to be a lot of research and a lot of future pathways. Thanks.